The survival in patients with mesothelioma still is quite poor. Median survival is approximately 1 year. Part of the reasons for this are that many patients diagnosed with this are in their 60s and 70s. They have other comorbidities, other lung diseases, heart diseases, possibly other cancers, which make them less appropriate candidates for aggressive treatment. Part of it is that even after aggressive treatment, trimodality treatment, which entails an extrapleural pneumonectomy, which is, again, the removal of the entire lung with its pleural coverings, part of the diaphragm and part of the covering of the heart, what's called the pericardium, followed by aggressive chemotherapy and radiation therapy. Even after this, patients are recurring. So what this is telling us is we need better systemic treatments to minimize the risk of recurrence. So despite the best efforts of the oncology community to date, survival in mesothelioma is still quite poor. There is a small subset of patients with mesothelioma, typically the epithelioid subtype, who, if they have the disease completely resected, and if the surgical margins, the boundary of the surgical specimen, does not contain tumor cells, and if there's no evidence of lymph node involvement in the center of the chest, those patients can approach 50% 5-year survival. That is unfortunately a fairly small subset of these patients.